Considering weight loss surgery presents many questions and can be overwhelming until you understand the options and their outcomes. Hello, I'm Dr. Fridman, and I'm one of the surgeons on our team at Griffin Bariatrics. We have a team of bariatric surgeons who have been successfully performing bariatric procedures for nearly 2 decades. When you become our patient, we as a team are dedicated to you and will always be available to you no matter the day or the hour.
I'm thankful for Griffin's bariatric program because the hospital itself, phenomenal facility. The doctors that were here, the nutritionists that are here, everything went smooth.
We believe that you deserve the personal attention from a team whose expertise is dedicated to those we serve.
I cry before surgery. It's nerves, it's whatever. I just start crying. I'm not sobbing, it's just tears coming down. Dr. Fridman came over to me and I'm just still crying, and he just patted my arm and he goes, "You're gonna be okay. This is gonna go okay." But it was just that kindness and the compassion in the OR that I tell everyone that one just because it meant a lot to me.
As a surgery center, we've worked diligently to become an accredited facility. What that means for you as a patient is that you can be assured that we've been independently evaluated and credentialed to be a high-level medical center. Accredited centers are recognized for maintaining successful outcomes, having shorter patient recovery times, and minimized complication rates. To maintain that standard, we are reaccredited regularly to assure that your standard of care is always a priority. Whether you're considering bariatric surgery yourself, or you're walking beside someone who might be, welcome. I'm glad you're asking questions and are considering a surgery that will dramatically improve more than the numbers on your scale. Morbid obesity has become a global epidemic, and statistics in many countries all over the world have escalated. Those who struggle with obesity suffer more than just the problem of being overweight. The extra weight puts stress upon all the systems in our bodies and is directly linked to over 60 other medical conditions, including heart disease, sleep apnea, diabetes, acid reflux, high blood pressure, and surprisingly to many, cancer. The American Cancer Society says that the link between morbid obesity and several types of cancer is nearly as strong as the correlation that smoking has to cancer. It's important to understand that morbid obesity is actually a disease that involves not just your eating habits. It encompasses your brain, your gut, and your hormones. Our bodies get comfortable at a certain weight, and then our brains can send hormones to tell the body to remain at that weight, confusing the body's metabolism almost without regard to activity level. So no matter whether you're dieting, exercising, and watching calories, your brain can override logic, confuse your metabolism, and make your body hungry, consequently causing weight gain and also prohibiting weight loss.
I was about 19 when my weight started to come on from the PCOS, and so I gained about 70 pounds in 2 months. I had gone to doctors, I had tried probably every fad out there to lose weight. It didn't matter what I did, I just couldn't ever lose it.
It's clear that our bodies are not designed to handle excessive weight. So there are 2 questions to address if you're considering weight loss surgery. The first question is, are you a candidate? And if so, which procedure will offer you the best results for your circumstance? In order to be a surgical candidate, the National Institute of Health established guidelines for us to follow. Body mass index, or BMI, is a number that is calculated to help us to quantify the severity of obesity. Those with a BMI that exceeds 40 are considered automatic candidates for bariatric surgery. Patients with a BMI between 35 and 40 who also have an additional medical problem like diabetes, high blood pressure, or sleep apnea will qualify for surgery. Those numbers and guidelines offer us the ability to work with insurance companies for patients to receive insurance coverage for procedures. Once you become a candidate for surgery, it's important to understand that surgery is simply a tool that helps you accomplish your goal. Surgery will help you set the path to a new lifestyle, and those changes will render the results you're looking for. The decision to have bariatric surgery must be accompanied by a lifelong commitment to modification in eating habits, a commitment to a healthier lifestyle, and change in your relationship to food. You will need a support system, so having a family member or a friend or a support group that will walk beside you is critical to your accountability and your success. In the months following surgery, you'll find it helpful to be able to ask questions of other patients who have been on their journey longer than you have. So we'll encourage you to establish those connections.
We came in for Dr. Fridman's seminar and for my husband, because he was diabetic. And once I saw the list, the migraines, the PCOS, the infertility, that I decided, wait a minute, I have all these things too.
We figured if we did this, let's do it together. If we're going to change the way we eat, we're going to change the way we live, we're going to change how we work out, let's do it together. And it's a blessing that we did.
2 weeks before the surgery, we will have you follow a specific diet, consisting mostly of liquid protein shakes. Patients with morbid obesity tend to have larger livers, and consuming the foods we prescribed helps shrink the liver, which facilitates us in doing your surgery more easily. Each procedure is done laparoscopically using very small incisions, so postoperative pain is minimized. No matter the surgery, the way a patient loses weight is through restriction and appetite suppression. Restriction means exactly that. We've restricted the size of the stomach, which means that a smaller stomach limits the amount of food it can contain, thereby decreasing your caloric intake. Appetite suppression is a natural outcome of bariatric surgery, because the surgery has an effect on your hunger hormone. Hormones are altered and will change your appetite, and you will eat less because of this effect. Malabsorption occurs only in patients having a gastric bypass, because the procedure literally bypasses a portion of the stomach and small intestine, affecting the absorption rates of nutrients. Whenever surgery is performed, there are inherent risks and potential complications. Here at Griffin Bariatrics, because we are an accredited center, we see very little of these incidents, but any surgery will carry identical risk of bleeding, infection, or blood clots. The possibility of a blood clot risk is naturally higher in a patient with morbid obesity, and we address the risk with significant care. Each patient receives blood thinners before and after the surgery to minimize the potential for problems. We have refined our surgical procedures to reduce the amount of time our patients are under anesthesia, which also decreases your risk. As soon as possible, we'll get you walking and moving to promote circulation. We are incredibly attentive to our patients throughout the entire process of surgery and recovery. So if you happen to develop a blood clot, we are able to diagnose and treat it quickly to avoid complications.
They're used to patients coming through, and they know what the pains you're going through. They know what you're experiencing. They know how to treat it. They know how to care for you. It made it comfortable. It was a comfortable, I just got an invasive surgery, and now I have a nurse that actually knows what I've gone through and is able to kind of take care of me the way I should be, that I needed to be taken care of.
By the time you're discharged, you'll be able to do normal activities like driving and walking a staircase. The most important thing you can do post-op is move and walk to minimize gas pains. Because the procedures require us to inflate the belly, the best way to overcome the discomfort is to move. Gas pains usually subside within 24 hours. The specifics of each surgery are important to understand so that you and your surgeon can make the best decision for you. We will help you understand the anatomy of your digestive system so you can comprehend what each procedure offers. First, we'll address the lap band procedure. The procedure involves placing a silicone ring around the upper part of the stomach, which creates a smaller stomach for food to enter. Because the ring reduces the size of the stomach, you eat less food and lose weight accordingly. The band is adjustable to help you balance weight loss with nutritional requirements. The benefit to this procedure is that it is less invasive than other procedures, because we don't cut, staple, or remove or reposition any part of the digestive tract. The system is adjustable and reversible and carries a very low complication risk. Your surgeon will do follow-up care for several years, even a lifetime, to assure that the system stays in place and functions properly. Because the device remains placed within the body, there's potential for the need to remove or replace it within the first 5 or 7 years. Having this procedure results in losing approximately 50% of excess weight. Excess weight is the amount of weight over your ideal body weight. So if you're 100 pounds overweight, your lap band will help you lose about 50 pounds. The sleeve gastrectomy is another procedure performed for weight loss. This procedure actually reduces the size of the stomach because we divide the stomach almost down the middle, creating 2 parts. When we divide the stomach, we place staples down the center, creating a smaller, more narrow stomach, one that resembles a sleeve. So now you will use half of the stomach you once had, and we actually remove the half that is stapled off, because it won't be using any of its capacity anymore. This procedure works in two ways. By reducing the size of the stomach, you'll obviously consume less food, reduce caloric intake, and lose weight. The procedure also affects your hunger hormone, reducing the amount that your body produces, so your brain will not tell your stomach that it's hungry as often. A decreased appetite paired with a smaller stomach results in successful weight loss. This procedure provides the greatest potential to tolerate a wide variety of foods because it allows for normal digestion and absorption of nutrients. The way your body processes and digests food is not interrupted because we're keeping the digestive system intact, allowing the stomach to remain connected to the small intestine where nutrients are absorbed. The procedure is irreversible, and your success depends on the discipline to control portion and types of calories consumed, so not to stretch the stomach back out or confuse the body by continuing to eat a high-carb diet. Approximately 70% of the bariatric procedures we perform include the sleeve gastrectomy. It's incredibly successful. You can expect to lose 50 to 70% of your excess body weight. Each procedure comes with different risk factors. The potential complications that we watch for are leaks, strictures, and reflux. A leak may occur where the staples have been placed, which means that the contents of the GI tract are leaking from the stomach. It is extremely rare for this to occur because we reinforce the staples with sutures or a special material so you have a double barrier to leaks. If one were to occur, we would repair the leak surgically. Another complication we watch for are strictures. A stricture is simply a narrowing of tissue, often caused by scar tissue as healing occurs. This could make eating or drinking difficult because foods aren't able to pass easily through that portion of the stomach. If this occurs, we simply use an endoscope to stretch the tissue to allow foods and liquids to easily pass. This is also a very rare occurrence. Some patients may experience some level of reflux, which is heartburn. Physiologically, the pressure inside the stomach changes when we create the sleeve, so some patients can expect some level of reflux. We treat those symptoms with acid-reducing medications as long as necessary, but for many patients, heartburn usually subsides over time. Many patients will experience a short bout of nausea immediately after surgery, but it typically subsides within 24 to 48 hours. The third procedure we perform is called a gastric bypass surgery, because we literally bypass part of the digestive system. Normal digestion takes place when food enters the stomach and passes through the small intestine where nutrients are absorbed. In short, bypass surgery disconnects a large portion of the stomach as well as the upper part of the small intestine from the tract, creating a much shorter digestive tract. This surgery differs from the sleeve in that, although we reduce the stomach to a small pouch, the entire digestive tract remains in the abdomen and we aren't removing any portion of the stomach. Food intake is most dramatically modified with bypass surgery. Your diet immediately following surgery would consist of purely clear liquids with gradual additions of soft and pureed foods. Over time, you will return to eating foods you normally enjoy. Although any bariatric procedure has the potential to change your food preference and tolerance after your procedure. Patients can expect to lose 60 to 80% of excess weight in approximately 18 months.
I was hoping that I can come off of all diabetic meds, lose the weight. Just over a year after surgery, I've lost close to 90 pounds. Off of all insulin, no metformin, no diabetic pills. I thought it'd be fun to kind of look in the mirror and see a six-pack. It's there, There's some extra skin, but the six-pack is there.
My daughter and I just took a trip, and we did an 8-mile hike. And yes, I was exhausted, but it was still something I physically could do. At my heavier weight, there's no way I could have done that.
Potential complications with bypass also include a very, very small risk of leaks or strictures, but will also include vitamin and protein deficiency because you will no longer process nutrients the way you once did. In order to prevent vitamin deficiency, supplementing your diet with protein and vitamins is extremely important. Patients who have bypass surgery need to be aware of dumping syndrome. Dumping syndrome is avoidable by refraining from foods with a high sugar content. Without the stomach, The small intestines receive food from the pouch very rapidly. When you consume too much sugar, it enters the small intestines and it dumps the sugar into the bloodstream. In response, your body will release too much insulin to offset the sugar spike, thereby dropping your blood sugar. The rapid change will result in nausea, cold sweats, diarrhea, and maybe even chest pain. So avoid consuming more than 6 or 7 grams of sugar per serving of food to prevent that from happening. One last potential complication with bypass surgery is an internal hernia. Because we virtually reroute the digestive tract, there are new spaces within the walls of your digestive tract that could potentially cause herniation. It's extremely rare, but if it does occur, a simple laparoscopic procedure will repair it. Your choice of surgery depends on your age, health, goals, and other diagnoses. This video is meant to serve as an overview to the options you have with bariatric surgery. Your surgeon will discuss each procedure with you and develop a personalized plan for your needs. Curing morbid obesity through surgical intervention isn't just about weight loss. We're interested in seeing you at a healthy weight, but we're also concerned with curing diabetes, reducing the risk of heart-related illnesses, remedying sleep apnea, improving blood pressure, and seeing so many other benefits of substantial weight loss. 95% of our patients not only report successful weight loss, but also have an enhanced quality of life. Many reduce or stop medications they've taken for years because they correct or are cured of other health conditions. Today, they're able to do activities they only once dreamed of.
I haven't ran in probably since I was in the military when I was 18. I get on the treadmill and I can run now. No shin splints. I can actually jog and it feels good. Some people don't even remember me or look at me as being the big heavyweight guy, you know? I walk into a store and they're like, man, this guy's buff, you know? I'm going, oh, wow, cool.
I'm happy because I get to be closer to my husband, and that we have the energy to go do things. I'm happy that food's not what's taking over my life. I eat to live. I don't live to eat anymore.
We're glad you've made the decision to improve your health and your life. We'll be here every step of the way. You won't do this alone. And we are so glad you chose Griffin Bariatrics to help you. Thank you for entrusting your care to us. We're committed to your long-term success, and we look forward to the journey.
Griffin Health, empowering people, advancing care.